So go ahead and tell me your last name and your date of birth.
Lynn,
Uh-huh.
10/26/86.
Okay, perfect. That matches my labels that I have here that are invisible ink. Yes. All right. Have you had your blood drawn before?
I have, yeah.
Okay. Is that arm better than that arm, or do you have a preference? Does it matter?
This one's fine.
Okay, that sounds good. All right. So what we're going to do is I'm going to slide this in just a little bit to you. Tie this tourniquet on here. So I can pull that off with one hand. It is folded over. Does that feel okay to you?
Yeah.
Okay. So we're asking the patient if that feels all right. You know, if it's too tight, then we can readjust. So go ahead and close your hand and just hold it close for me. So I'm just palpating here on her the jubal vein here. There's the celiac, and then the cephalic would be way out here on the edge. She's got two good veins, but our first choice.
You're at M.
You are. Where would be? Yeah. Yours comes in there and there.
Okay.
All right. And it hasn't been over a minute yet, so I'm going to clean off the side here where we're going to draw the blood. I always clean the tip of my finger. It's just a habit,
Oh.
just in case. Okay, so we're going to allow that to dry. I'm not going to spit on it, blow on it, or wait on it because that's probably not going to keep it clean. So while that's drying, I'm going to go ahead and get my equipment. So I've assembled my gear. I've got my tube. Then I set it into the holder because it's a lot easier to do it that way than to have the needle in the arm and then have to fumble around here to get the tube on. That part's already done. So bevel is up, safety is back, unsheathing the needle. Wait, don't try to. All right, I'm going to anchor using this finger. I'm going to pull the skin tight, not very much. And I'm just going to give it a little bit of a poke. Okay, so I squeezed from the front of this holder to the back of the tube. Basically went like that. So I'm going to pull the tourniquet off now that I've got good blood flow. Are you doing all right?
Yeah.
All right, so I'm going to pull the tube off. Notice I use these two fingers and pulled it out. Now I'm pulling this out, you're going to see how much blood actually spills out. And the time that took me to pull this out, you know, I took my time. It wasn't very much. You know, some people will bleed more than that, but go ahead and hold pressure there for me while I go your tube. So I put the safety device on and I put the tube into the needle holder and the needle into the sharps container. So go and spell your last name for me.
BLEN
And my person.
ALISA.
All right. And date of birth?
10/26/86.
All right. And today is the what is today's date?
7.
4/7 of 16, and it is 17. And my initials. Okay. Another thing to remember, we want to make sure that we mix the contents of the tube appropriately so that there is the mixture of the anticoagulant, if appropriate, with the blood sample so that there's no clots in there. So I'm going to label your tube really quick. Another thing to note, you see that there's a color stripe on the side of the tube. That's important to leave exposed. Reason being, if I put this label over the top of it and I pull this cap off, what color was the tube?
Good question.
No idea. Yeah, I mean the lab tech's going over there and curse, you know, and peeling it back to see what tube color it was. But just as an FYI, that's what the color stripe is for. Almost all of the tubes now have that for the BD. All right, so I'm going to take a quick peek. It looks good. Stop bleeding. And put the tape on there. And I did put a tab over here on the side so you can pull that off without too much trouble.
Yeah.
All right. Do you have any questions?
Yes, I do.
All right.
It seemed like you didn't stick the needle in very far. I guess I'm not sure that's the question, but I'm just surprised that the vein was that close to the surface and it just took like a little.
Just a little bit of a
Yeah.
poke. And that's the. Everybody asks me, how do you know how far to go in? Because you know, once you're like, you don't want to go in too far. You kind of get the feel for where the vein is on the person. Once you start doing the process, then you learn how deep you need to go. I can tell you that when you guys first start drawing blood, you're going to want to go shallow and almost most likely you're going to either you'll push the vein out of the way, or you'll have the bevel of the needle exposed, and it'll just like blood will start pooling on the skin. So don't let it freak you out. You guys we'll walk through the process of how far in to go, because it doesn't take very much, especially with somebody with good veins. There's patients that have the deep veins that you have to actually hot pack and really feel for, and then basically you're burying the needle in the arm to get to that vein, because that's how far you got to go. Yes, it's